All right, we're going to do some palpation of the abdomen. And as a physical therapist, a lot of times we're doing palpation of the abdomen so that we can screen the patient for possible non-musculoskeletal conditions. So the first place I like to start with screening of the abdomen is doing some inspection of the abdomen. So with inspection, we're looking for anything that is abnormal, and that could be anything from the shape of the abdomen. Is it distended? Does it have a scaphoid type shape, meaning sunken in? Is the abdomen flat? Are there any scars across the abdomen that indicate any type of injury or surgery? Is there any bruising? Is there any stretch marks? Those are the types of things that we're looking for on the patient's abdomen. So you can visually inspect it from the top here, and then we can also step away and do some visual inspection from the side to get an idea of the shape and size of the abdomen. You should be able to see the patient breathing, and a lot of times you'll be able to see that abdominal aorta as it's pulsating. Something else you could see with a patient is the movement of a food bolus through the intestines. So you can see some, especially after a meal, you can see some peristaltic action and feel some peristaltic action from the intestines in the patient as well. So all that's pretty normal, and it's also normal to hear some bowel sounds as those bowels are actively moving food contents through the bowel. As far as palpation goes, I like to divide the abdomen into quadrants. So if we draw a line down the midline of the abdomen from the xiphoid process of the sternum down to the pubic bone, and then divide it across the umbilicus right here. That'll divide us into 4 quadrants. So we have the right upper quadrant here, the left upper quadrant, the left lower quadrant, and the right lower quadrant right here. Another way that's common to divide the stomach up is into vertical components. So we have the epigastric region here. Right over the umbilicus, we have the umbilical region, and then below we have the hypogastric region, or the suprapubic region right here. So dividing that up gives you an idea of where certain abdominal contents fit within the abdomen. So in this right upper quadrant, we have the liver and the gallbladder. In this left upper quadrant, we have a portion of one of the kidneys and also the spleen. And in the left lower quadrant, we also have the left kidney, and in the the right lower quadrant, we have the right kidney. So, and then the intestines coming all the way through here, and also the colon coming up, the ascending colon coming up from the right lower to the right upper quadrant, across the stomach, and then down the left quadrants. So let's go ahead and start with palpation of the liver. There's 2 methods we'll teach you here. The first method is to find that upper costal margin, that upper right costal margin right here. Once you've found those upper ribs, we know the liver sits right under that right costal margin in the upper right quadrant. And the bottom edge of the liver sticks out a little ways from this costal margin here. So if you find the ribs there, go ahead and roll off the ribs, and you should be able to feel the medial edge or the inferior edge of that liver as it's sitting outside of that costal margin right there. So I'm not feeling a ton of detail on the liver here. I'm more feeling for an end feel that feels visceral. So a lot of these organs give you a firm type end feel. So I push through this soft end feel of the skin and adipose tissue, and then I run into that firm end feel of the liver right there. Now, if I have the patient inhale, go ahead and inhale for me. The diaphragm, as it contracts to pull air into the lungs, it also pushes a lot of the viscera down, and you can feel it push the bottom edge of that liver down a little more inferiorly, making it a little bit easier to palpate. Okay, an alternate method for palpating the liver is coming up here and from the superior side and finding that costal margin again, and then just wrapping the fingers down around and feeling that liver. And each time he takes a breath, I can actually feel that liver descend into my fingers, and it gives me that nice firm end feel that's common for some of those organs. Okay, for the spleen, we know that's under this left lower rib cage right here. So from the right side of the patient, I'm going to take my left hand and put it under the bottom of the rib cage right there. Then I'm going to take my right hand and find that lower rib cage and try to come underneath that lower rib cage as I'm lifting up. And again, we're not getting real detailed with palpation here. The spleen is not palpable in most patients, but as you pull up on that rib cage and push down, you may be able to feel one of those anterior borders of the spleen right there. Okay, it's really similar for palpating the kidneys. For the left kidney, we're going to be very similar to what we just did with the spleen, but we're just going to move down. So I'm going to come underneath the rib cage right there, almost to the lumbar spine, and I'm going to pull up on the patient while I'm pushing down. So if I find the umbilicus or the belly button, I'm going to move just laterally to that, and kind of in the midline right there from between the belly button and the side, I'll give some deep pressure while I'm pulling up. And again, I'm not going to find any detail here. The left kidney is extremely difficult to palpate if it's palpable at all. If you do palpate it, you'll get an idea of more of an end feel and less of a detailed palpation. So if I palpate deep there, I can start to get a sense of the end feel of the kidney that's very, very deep. Even though I can't get a lot of detailed palpation, I can feel the firmness of the kidney in there. Okay, and then lastly, we're going to do the right kidney in a very similar way. I'm going to take my left hand, put it underneath the rib cage, go just lateral to the umbilicus, and push down while I pull up. And the right kidney sits a little bit lower and is a little more palpable than the left kidney. And again, I'm just looking for that firmness that I get when I palpate an organ, and I'm also assessing for the patient's symptoms. So if there's inflammation in one of these kidneys, it might express itself through palpation. Okay, and lastly, we have the abdominal aorta. The abdominal aorta, to palpate that, I'm going to find the umbilicus and go just above the umbilicus in the midline, and I'm going to press down deeply until I start to get a pulsating feel from the abdominal aorta. And it's very deeply set right in front of the spine. So there it is. I start to get a little pulse right there. And then I can measure, once I've palpated the pulse, I can measure the width of the abdominal aorta. So I'm going to keep this hand there and turn it vertically this way and palpate in this direction. And I get I can feel that pulse in my left hand there, so I'm going to move my left hand. And I'm going to continue moving until I can no longer feel that pulse of the abdominal aorta. And that's about right there. So you can see it's not real wide, and that's kind of what we're looking for. If we do have a patient where we're palpating the abdominal aorta and it's extremely wide, that may be a clue for an abdominal aortic aneurysm, and something that you'd want to refer the patient for some imaging. So that's one way you can palpate that abdominal aorta and check for a AAA.